Powell died from COVID-19 and he had been battling cancer. He was also fully vaccinated.
And joining us now with a little more insight on Powell's health, Washington Post correspondent Philip Bump. Philip, good to be with you again. Thanks for joining us tonight. So much has been made about the rarity of these breakthrough diagnoses here. But it is rare for someone to die from COVID after being vaccinated. But we've been talking about Powell's underlying health. Can you elaborate more on the condition that he was facing?
No, you're exactly right. So Powell, over the course of his later life, had a number of afflictions, including Parkinson's disease, and including this multiple myeloma, which is a sort of blood cancer that can leave you more prone to infection. One of the things that we have seen from the data, looking at those people who are fully vaccinated against the coronavirus, is that it is still the same group of people who are nonetheless at most risk of dying from the disease. Those are people who are over the age of 60. Obviously, Powell was 84. And people who have other conditions that may be complicating factors. So while the vaccine does greatly increase, 11 times better, 11 times less likely to die from the coronavirus if you're vaccinated, according to new data from the CDC. It is, no one has ever said that it is 100% effective at preventing any sort of death from COVID-19, particularly among people in that category.
Right, Philip. I mean, that vaccine is exactly what medical experts had hoped for to halt the pandemic. But as you mentioned, certain groups it doesn't necessarily work for. And Colin Powell, a cancer patient, 84 years old, is a perfect example of that. But perhaps another example of why other people, healthy people, should get vaccinated.
Yeah, exactly. I mean, and I would be hesitant to say it didn't work for him. We don't know, obviously, the extent to, what course the disease might have taken otherwise. I mean, obviously, this is a worst case scenario. But you raise a very good point, which is that one of the goals of vaccination is for the country broadly to reach what's been called herd immunity, which is a place where there is so much resistance to the virus that it can't spread. And that helps protect people who, for whatever reason, can't get vaccinated or who may be in a group like Colin Powell that is more at risk. So even though he was vaccinated, he still was more at risk simply by virtue of his age and these other conditions. If the country were seeing, 1 or 2 cases a day simply by virtue of how much herd immunity was out there, then he would have been at almost no risk simply because there wouldn't have been anyone for him to catch it from in the first place.
Right. And when you talk about that idea of herd immunity, if more people had been vaccinated, his life may have been saved. When we look at the numbers each day that are dying here in Illinois and across the country, those people may have been saved if more people got vaccinated.
Yeah, so the Kaiser Family Foundation did a study, and they found that about 90,000 people died over the summer who didn't need to simply because they had not been vaccinated. So there is a real effect from the vaccine itself in terms of death and protecting people's individual health. But your point is exactly right. It is about the broader health, the community health. If there are no cases, if you're only seeing a few cases in a state on a given day, then you don't have to worry about contracting the virus, even if you're not vaccinated, right? Because there aren't enough people for the virus to spread to once you reach a high level of herd immunity. We are not at that point. We saw this big surge over the summer, and it looks, unfortunately, as though Colin Powell was a victim of it.
Yeah, and you refer to that CDC report that said the vaccinated Americans are 11 times less likely to die, 6 times less likely to even get infected. But given that, the CDC also said that fully vaccinated elderly people who are over the ages of 80, are about as likely to die if they get a positive diagnosis than those who are unvaccinated in their 50s or 60s.
That's right.
So that is leading to a lot of confusion, and that's why it seems like it is a murky argument for people to try to wrap their heads around.
Yeah, no, 100%. I mean, these are complex numbers that involve obviously very serious repercussions here, right? But you're exactly right. So when we actually look at the data of what the vaccination numbers from the CDC say, we do see that people who are vaccinated and in that oldest age group, people 80 and older, they still can have about the same incidence of death as you might see from a younger age group, people who are 50 to 64, even if they're that younger age group is not vaccinated, but that's because the risk is so much higher for the people that are older. And actually, if you look at the CDC data, you find that among the oldest Americans, the difference is about 5 times. You're about 5 times less likely to die if you are vaccinated than if you're not. But as you get younger, it really stretches out. So if you're, between the ages of, I believe it's 30 and 49, this is off the top of my head, but you're something like 27 times less likely to die because the effects are that much stronger because you're in an age group that's less prone to dying from COVID-19 anyway. So there are differences based on age in a lot of different ways, but the fundamental fact is you are better served by being vaccinated even in that older age group, even though you're more at risk anyway.
Interesting thought, and I know there's more in your article in the Washington Post. Philip Bump, thank you very much.
Of course.